Morning and welcome to our regular briefing for the COVID-19 response for the state of Utah. My name is Joe Doherty. I work for the Utah Department of Public Safety. Today is Thursday, December 3rd, 2020, and it's my pleasure to introduce Governor Gary Herbert, who will be followed by our state epidemiologist, Dr. Angela Dunn. Governor Herbert.
Thank you, Joe. Welcome, everybody. We're honored to have you here with us today in our weekly briefing. In reflection upon where we've been and where we are, it's been virtually 9 months since the pandemic struck here in Utah, longer for other parts of the world and the country, but 9 months, it's been a long time as we've been engaged. And unfortunately, the reality is we have many months yet to go before we get out of the woods of this challenging time that we face with this COVID-19. The CDC, in fact, indicates that the next few months, maybe the next 45 to 60 days, may be the toughest stretch of all, as we see case rates going up, infection rates increasing, and many of the states, nearly 40 of the 50 states, having the highest case rates and infection rates they've had since the beginning of the pandemic. We certainly see that's true here in Utah. Our graphs mirror what's happening in the other states around the country and other countries around the world. The challenge we face at this time of year is, one, it's colder. More of us are going indoors for activities, which forces us to have more social interaction at a closer distance. It's the holidays, which is family time, a time for us to get together with family and friends. And that presents a real challenge for us as we go into the holiday season and into the new year. On November the 8th, I announced what we called a two-week pause, kind of a reset, kind of a let's take stock of where we're at and see if we can't redouble our efforts to slow the spread of the coronavirus. We put a pause on extracurricular activities in our high schools and asked people to limit the gatherings that they have to just their household at their homes, to not only have smaller gatherings but shorter time frames, all done with the idea of the ability for us to slow the spread of this virus. We appreciate the work of many people in trying to accommodate those requests. We've began to ramp up testing. We think testing is a key for us, particularly as we've learned that more people are asymptomatic, and yet they're spreading the virus. Don't feel sick, but they're spreading the virus nonetheless. And so we've increased our testing capabilities. We're going to continue to ramp that up as we are able to with the supply of tests that we're trying to get through the CDC. Again, we're somewhat beholden to what they have available to us, but we're going to ramp up testing nonetheless. We tested football teams and found it interesting that they had a smaller percentage of cases. And that tells us two things. That people can, in fact, modify their behavior. They wanted to play football, and so they, in fact, modified their behavior so they were not sick and were able to, in fact, engage in their football playoffs. So that's the first thing we learned. And the second thing is that we did the testing. As we did this testing, we're able to identify people who are, in fact, asymptomatic and don't feel sick, but get them isolated so they don't spread the disease to somebody else inadvertently. And so those two things are important as we think about that, what we need to do now going forward. We're going to still maintain the statewide mask mandate. Study upon study is showing the effects in a positive way of mask wearing. The University of Utah announced just about 10 days ago their study to add to the other studies that are out there, but an exhaustive study where they reviewed all the counties in all the states of America and found that not only wearing a mask does it reduce the risk by about 70% and slow the spread of the coronavirus, but in fact it enabled people, emboldened them. They felt confident to go outside and be more mobile if they in fact wore a mask. This increases economic activity, so it not only helps prevent the spread, but increases mobility, got people outdoors, more shopping, less isolation. Again, it was win-win-win. And the fact that masks are good for the economy is an important aspect along with slowing the spread. Now, we just came off the Thanksgiving weekend, and after our 2-week pause and our reset, and in the week of Thanksgiving, we saw slower case numbers. That was the good news. We saw many people that changed their plans and tried, in fact, to follow the recommendations of just meeting with their household or small gatherings, making sure they had social distancing, wore masks at their gatherings, kept them shorter of duration. But unfortunately, as we're starting to see now, and we're not surprised, the case numbers are starting to go back up. It's about 6 days after Thanksgiving, and we're going to see that number increase. I hope not too dramatically, but we're seeing it dramatically enough already. So clearly, we need to remember we drove the cases down when we limited our social gathering. We're going to drive the cases up if we gather in intimate situations with our friends and family. And our worry is not only just the spread of the virus and case numbers, but it's the increasing uptick in hospitalizations. It's particularly uptick in ICU bed space, which we're at the brim now. We're really at maximum capacity. And of course, what follows on the heels of those numbers is increasing death rates. So again, we've said before, we need to be careful about what we're doing because the hospitals can only accommodate so many of us. And so that's a very much a concern for us. Let me just give a shout out again to our hospital workers, our healthcare providers, those on the front lines of this effort to fight the pandemic. They're doing tremendous work, and they're overtaxed and overworked. And we need to appreciate the work they're doing and do our part to help slow it down so they can continue to maintain what we have already in place. But they have a very heavy load. I also appreciate the teachers out there that are, again, facing maybe a heavier load because of the fluctuations, the ups and downs of school admissions and closings and online and then back to in class and the uncertainty that is taking place there. We appreciate the teachers for what they're doing and how they're doing. Hospitals are doing what they can to handle the influx, and the state's also stepping up to help in that area too. We currently have contracts with 4 long-term care facilities that are acting as a pressure relief valve for those now as we're starting to have capacity and then some, and we have to have a release valve where these people can go and get some relief and some health care treatment, even though it may not be as good as they'd find in the hospital. It's costing us about $700,000 a month for these facilities, but something we need to do under the circumstances. Again, as I mentioned, the CDC has indicated the next 45 to 60 days are critical in how we handle this pandemic, and the holiday season through the new year and beyond are challenging times. Again, I think particularly for Utah, we are a very family-oriented state. We have larger families. We tend to gather all the time throughout the year, not just holidays, but more acutely during the holiday season. We get together and share that holiday spirit with friends and family. And that's a recipe for increased infection. So we need to be careful about that and limit our gatherings now. Unfortunately, we are continuing to spread the disease to people who can't handle the serious effects. We have our younger people, which are getting the virus. Some of their social gatherings, not necessarily at school, but their social gatherings unscripted, and they take it home and infect their parents, infect their grandparents. And as we know, this is age specific, and so the older you are, the more severe the reaction. We find that 76% of all of our deaths in the state of Utah are on those that are over age 65. 76%. That's about 400, by the way, sets of grandparents that we've lost in the 9 months from this pandemic. That's a tragedy for a state that considers themselves very family-oriented and family-friendly when our grandparents, in fact, are taking the brunt of the mortality rates because of this pandemic. So, in the week of Thanksgiving, we began to see some slower case rates, but we're on the uptick now, and we can't let our guard down. We need to make sure that we understand what we should do. You know, the guidelines are still the same: social distancing, wearing of the face masks when you're out in public. Keep your gatherings to just household members. Good hygiene, wash your hands. All the typical common sense things we know are just as important today as they were 8 months ago. And the good news for us is there is help and hope on the way. We now are on the verge of having 2 vaccines approved by the FDA, Pfizer and Moderna. I expect that we'll have approval of those in the next week or 2, which allow us to start receiving vaccines here in the state of Utah and allows us to start to distribute those vaccines to the folks that need them. And we'll do it on a fair, an ethical, and a transparent way. Those who are most vulnerable will get first. The healthcare providers on the front lines will get first opportunities. If you want to know about our vaccine deployment program, you can go to coronavirus.utah.gov/vaccine and see the plan that's being put in place. Now, it'll be updated. We're just in the process of developing it. It's certainly based on how many vaccines we can receive, and that's something we don't have a lot of control over. But I expect it will be ramped up as we have more and more and more vaccines, so that, as we've heard from the CDC and from the administration, we hopefully will have enough vaccines so that by springtime, March, April, May of this year, everybody who wants to have a vaccine will be able to have a vaccine. That's going to help us slow the spread and give us relief, and starting to help us recover and return back to more normal socialization. Now, no, we have no plans to make that a mandate, by the way. You mandated to have a vaccine, but we think that most of the people in Utah will want to have one to protect themselves and their loved ones. So we're looking forward to that opportunity as we develop our vaccination plan and how we're going to distribute that. I think the first ones, by the way, we'll be able to do here this month of December, and that will continue to increase, as I say, through the holiday season into the springtime until everybody has an opportunity. With that, let me just say that in conclusion from my part here on the program, it's easy to be discouraged. This pandemic's lasted a long time, and for, I think, all of us, we've never seen this before, nothing like this in our lifetime, and so it's new, it's uncertain, it's discouraging, it's frustrating. Things we normally want to do, the important things in life, gather with friends and family, we're now being limited to do. And that's frustrating and discouraging to all of us. But again, we are on the verge of breakthrough here. It's a matter of being disciplined in what we do and make sure that we understand that, again, we are getting to the point where vaccines are going to help us. We get in the springtime, we'll be on the road to recovery. So persevere, stay committed, stay strong, Utah, and we'll get through this together. With that, I've asked Dr. D'Angelo Dunn, our state epidemiologist, to come and give the weekly report on the latest case numbers. Dr. Dunn?
Good morning. Today, our 7-day rolling average of new cases is 2,627. This has been falling steadily since about November 23rd, when we peaked at a 7-day average of 3,349. Our rolling 7-day percent positivity is 24.2%. Now, this has been increasing. Just this Monday, we were at 21.5%. Throughout this pandemic, we've seen that immediately following an increase in the percent positivity, we do see an increase in cases. As the governor mentioned, right following Thanksgiving, we saw some really encouraging numbers with some of our daily case counts being under 2,000. However, that trend has not held. Just yesterday, we added 4,004 new cases, and today we're adding 3,945 new cases. So transmission is still definitely widespread throughout the state. We likely don't yet understand the full impact of Thanksgiving on the spread of COVID in Utah. Our hospitals are continuously stressed. We have 597 people currently hospitalized due to COVID in Utah, and our referral ICUs are at 89% utilization. But as the governor mentioned, we are so close to vaccine distribution. Our federal partners have anticipated widespread vaccination as early as April. And yes, it's going to take time for us to fully see the impact of vaccine on slowing the spread of COVID. However, we can see the light at the end of the tunnel. So we really need to hold steady over the next several months, wearing our masks, trying to keep our close contacts to our household as much as possible, practicing physical distancing, and of course, if you haven't yet, get your flu vaccine. I'd also like to take a minute to talk about new recommendations to our quarantine policy. Effective today, we are going to be aligning our quarantine policy with the new guidelines that were distributed by the CDC yesterday. So these new guidelines are as follows. If you've been exposed to someone with COVID-19, you should now quarantine for 10 days. You can be released from quarantine after 10 days if you remain asymptomatic without symptoms. Alternatively, you can test out of quarantine on day 7. So if you get a specimen collected on day 7 and that result is negative, you can end your quarantine as long as you don't have any symptoms. The purpose of these changes to the quarantine guidelines is to reduce the hardship that has been placed on individuals due to a full 14-day quarantine. However, there is still risk to developing COVID after a 10-day quarantine or after testing negative on day 7. So it is still so important to wear a mask and practice physical distancing as much as possible. And you can find more details about these new guidelines on the coronavirus.utah.gov website. Thank you.
Thank you, Dr. Dunn. As I mentioned, it's easy to be discouraged, but as we hear, there's reasons to be hopeful and optimistic about the future. We're going to go through, I think, a tough stretch right now, but if we all knuckle down and do our best, do our part, we can make it less bumpy than otherwise would be. I want to give another shout out now, and that's really to the private sector. The private sector has had a big challenge economically. Many of our businesses have a hard time to struggle to stay open. We had a watch phrase that we started with when we began this pandemic, which I think is a good one to remember. We said you need to adapt to the circumstances we find ourselves with, innovate, find ways to circumvent the problem and find ways to be creative, and then overcome the challenge of the pandemic. So adapt, innovate, and overcome. And I appreciate many of our private sector businesses have found ways, in fact, to adapt, innovate, find creative ways to still provide service and goods to the customers out there, continue to not only survive but thrive, and overcome this unique and challenging and uncertain time. I hope we appreciate, again, that we have 2 vaccines developed by the private sector with the help of federal government, but they've done a vaccine in a record amount of time. Normally it takes 3 to 5 years, and that's a pretty quick period of time to develop an FDA-approved vaccine. The fact we've been able to do this in around 9 months is a remarkable tribute to the private sector and their innovation, their ability, in fact, to muster everybody in kind of an all-hands-on-deck effort to give us the vaccines, which we'll see released this month, I'm sure. So again, we appreciate the work of so many, in particular the private sector, who's learned how to adapt, innovate, and to overcome. With that, we'll take a few questions.
Hi, Governor. This is Jacob Klopfenstein with KSL.com. I wanted to ask, earlier in this press conference, you said that you're not surprised to see an uptick in cases after Thanksgiving. You also said that or that we're aware that cases go down when we limit social gatherings and they go up when we don't. So knowing that evidence, I'm wondering why you decided to go against that before Thanksgiving and decide to eliminate those restrictions on home gatherings, and if you plan to reinstate any limitations on home gatherings before Christmas.
Well, I think it's kind of intuitive for most of us that you cannot enforce what takes place in the 4 walls of somebody's home. And that's an intrusion of government that I think most of us feel uncomfortable in making. So we did it for the 2-week pause, kind of the reset, kind of a shock the system attempt to say this is serious. And it did work. And I think people did, in fact, become more cognizant and probably more deliberative and cautious in their behavior. But with Thanksgiving coming, I didn't feel like it was appropriate for us, in fact, to say we're going to have the police looking through your windows and seeing what you're doing in your home. Doesn't mean it's still not a good idea. In fact, we've said the guidelines are still the same. It's still dangerous out there. And those guidelines continue to be in place. And we expect that government has a role to play, but we also have a role to play as individuals. We need to take on individual responsibility. You don't have to have a policeman come on, knock on your door and say, or members of your household, the only ones you have here having dinner today. You should do that because that's a good health guidance, and that helps slow the spread, protects yourself and your family from infecting each other, and slow the spread for the community at large. So again, we ought to do the right things for the right reason, I said from the very beginning. And we'll always take a look at things to see if we need to make some modifications, but that's a bridge too far for me to say we're going to watch what you do inside your home. Next question.
Hi, this is Ross Terrell from KUER. Not sure if this is better for the governor or Dr. Dunn, but right now we're seeing cases rise in long-term care facilities. They're facing staffing shortages and they're kind of at crisis levels. Are there any plans in place to get them more resources or increase staffing to help them deal with this outbreak?
Would you like to take that?
So throughout this outbreak, whenever we have an increase in community spread, it does eventually get into our long-term care facilities, which bears the greatest burden in terms of mortality and people who die from COVID. And that's true now more than ever. We do have plans to get more beds for COVID-specific patients in long-term care facilities so they can get the care they need safely. And we are looking at trying to figure out, CARES funding is ending in December, and trying to figure out what that means for supporting not only long-term care facilities, but the response overall moving forward. So that's something we're actively planning, but no concrete decisions yet.
Got it. And then, Governor, quick question for you. We did see a slight increase in travel over the Thanksgiving holiday. Obviously, we have a number of ski resorts here. Are there any concerns that people may be bringing COVID from other places coming here to take advantage of the ski resorts?
Absolutely, there are concerns, and I know the ski resorts, which we're working with closely, are trying to put protocols in place to minimize any kind of risk. Because if that risk goes up, like we saw the end of the ski season, people stop coming. So they're only going to come here if they feel safe, and that means we need to make sure that those who come here keep it safe. So the protocols the ski resorts are putting in place are going to be acute mask wearing at all times and social distancing. Probably tests will be made available by the ski resorts themselves to make sure that people can be tested, even if they're asymptomatic. Testing will help us, I think, in many ways. As how we'll apply that is yet to be determined. But again, we are concerned about people that come from out of state to Utah. We also know that people are coming from out of state to Utah now, whether it be California or Nevada, because they're so closed down that people want to come to Utah where we're a lot more opened up. And that's good news from the standpoint it helps our economy and the fact that we're doing something right that people want to come here. But it also creates a challenge of a two-edged sword because they may be bringing some of the virus to our state also at the same time. So we're concerned about that and looking at the same possibilities and options. But right now, we're just hoping to people will pay attention to the wet mask wearing and social distancing, good hygiene, and if they are sick, to stay home and provide additional testing so we can find those who are asymptomatic and still have the virus. So we're going to attack it on many fronts. Next question.
Hi, I know you said earlier that there's not really any consideration of a statewide mandate for vaccines, but I'm wondering, is anyone at the state level contemplating any more limited type of enforcement or mandate, for example, like in schools as there are for other vaccines, you have to get them to go to public school, or even, and I don't know what the existing rules are for this, but can private employers require their employees to be vaccinated? as a condition of employment?
That's probably in the process of decision making from the standpoint of the private sector. I think it would be entirely within their abilities, their constitutional rights as an employer to say, if you're going to come into work for me, I want to make sure that you have the vaccine so we don't get people sick here on the job. The public sector might be a little more difficult. We do require vaccinations for people that attend school with some exemptions. Religious preference, maybe some health care issues. So there are exemptions to the mandate for vaccines at school attendance. So that's something that we are going to be wrestling with as we go forward. Dr. Dunn, have you got anything you'd like to add to that?
And then just to be clear, the vaccine that's getting approved through the approval channels right now is just for 18 and above. So when the vaccine is rolled out in the spring, it actually hasn't been validated in younger populations. Studies are going on right now for teenagers. So we're anticipating that 12 to 18 range they're going through trials right now, but the younger age range is not included in those trials. So it's going to be some time before there is even broad availability for school-age children.
Thank you. Next question.
Hey, it's Michael Locklear with 2 News. I have a question for Dr. Dunn. We've talked a lot about asymptomatic testing, and I have a question about people with very mild symptoms that don't match the most common ones like fever and cough. It can be very difficult for people with very mild symptoms to get tested. Why is there not more of an emphasis making it easier to test people beyond the most common and most serious symptoms?
So anyone could go to testutah.com, symptoms or no symptoms, and schedule a test. So that is available through testutah.com right now.
Next question.
Yes, if cases ramp up too dramatically in the coming days and weeks, will you again issue another pause, or are you anticipating the Christmas school breaks will help with that?
We have our unified command that meets every day and reviews the numbers to make determination as far as the policy we have in place working. Is there something else that would work better? Should there be modifications? We are on a weekly basis meeting with the legislative leadership so that they're up to speed with what's taking place. So right now there are no plans to modify what we have in place currently, but that doesn't mean things can't change by next week. Next question.
Hi, Governor. It's Ben Winslow with Fox 13. Just wanted to ask, with CARES Act funding expiring by the end of this year and a lot of restaurants and bars being impacted, particularly by your 10 p.m. alcohol order, is there any plans to provide relief funding for bars, restaurants, and the hospitality industry?
There's actually discussion about another relief package, another tranche of money. Could be up to $900 billion is what I've been told. I've talked to Senator Romney, Congressman Bishop. I've met with the administration. I've met with the vice president. I've talked to the president here just in the last 2 days. And there is a desire, I think, by the majority of people in Congress to have another a wave of money to help in those kinds of circumstances. The business community, those that are struggling to survive, but they just can't, at least so far, have come to an agreement on the amount. The Democrats seem to want more money, the Republicans a little less, but that's a debate that's going right now, and I expect that probably before the end of the year that they'll come up with some kind of a relief package that will hopefully have broad-based support. I think that's going to happen. Here in Utah, I'm a little concerned about the continuing debt. There's not been a lot of talk about the debt, which we've increased by $4 trillion just this year alone. Not that it's not necessary, and there's probably a ways for us to do it. I'm pleased and grateful that we are here in Utah, where we in fact are a little more fiscally prudent. We don't have quite the demands and the needs that some of our other states that really don't have a AAA bond rating like we do and don't have a large rainy day fund like we do. So we're in better shape. But overall, the Congress and the administration have to kind of think of the United States as a whole, make sure that all states are treated fairly. I think there is a significant effort going on to find a number that everybody can support. At least there's effort. And my prediction is probably before the end of the year, we'll have something.
But any plans to spend state money that you still have on bars and restaurants that are being impacted now?
That's being reviewed right now to decide where the best bang for our money is going to be. Bars and restaurants have been part of the harder hit areas of our economy. And so that discussion continues. It really is a matter of what the legislature is willing to do with some of the monies they control and have. And so that's under discussion right now.
Hello, this is Haley Hendricks with ABC4. This question is for both Dr. Dunn and Governor Herbert, and it's following Governor Herbert's comment saying the CDC is reporting the next 45 to 60 days could be the toughest of all. So my question to you guys is, what do you think could be the greatest challenges Utah faces in this time frame, and how do you plan to tackle the challenges?
Well, for me, it really is the social gatherings, and it's not the structured gatherings where people really put protocols in place that you will have to social distance, will limit the number of people that participate in the event. We all are required to wear a mask. It's the interactions we have that are just kind of casual, particularly our high school students after school as they get together and hang out together. It's kind of the rite of passage. Even older people get together and hang out and do things. Those are the areas that I'm most concerned about, where we're going to have probably the increasing spread. And again, it's the younger people, the highest infection rates of spread passed on to the older people who have more severe reactions that pass on to the older people, in fact, not only have a severe reaction, but increased mortality. So that's my issue. Dr. Dunn?
Well, Governor Herbert, then how do you plan to tackle these challenges and concerns that you have? Is it just continuing to reinforce people to wear masks?
Absolutely. Again, we can't say it enough times because evidently not everybody's wearing a mask. But by the way, if you saw the report that just came out, Utah has been very good at wearing a mask, comparatively speaking. We're right in the middle of the pack. At least we're not at the bottom. We're about 26 of the 50 states when it comes to the percentage of people wearing masks appropriately. So that's good news. So evidently what we're doing, the promotions that are out there telling people to wear masks are actually resonating with the people. And again, with the University of Utah study, we all have to say, wow, it improves, limits the risk by 70% and allows people to go out and still engage in the community and shop and helps our economy. It's win-win-win. So that part is working. What is not working as well is our social gathering. Now, I don't know how you stop people from getting together. You know, I think that having the Gestapo tactics of breaking up a crowd might be just a little bit difficult. But we are very, again, socially oriented in the state because we have such large families. Another statistic that most people are not familiar with is that we have the most densely populated area, the 7th or 8th most densely populated area in America between Ogden and Provo. So we're kind of crammed in here together anyway. Most of the states more rural and more open, but between Weber County and Utah County, we're pretty densely populated. That contributes to our gatherings like sardines, which in fact is part of the reason why we probably don't have the social distancing that other states have. We're at the bottom of this. We're like 46th, 46th, or 47th in the nation when it comes to not following the social gathering guidelines.
Thank you for that.
Sure. So, right, in addition to what the governor said, it's colder. We have holidays going on. People are going to be inside. After every single holiday throughout this outbreak, about 8 to 12 days later, we saw a surge in cases. And those were when the weather was nice and we were gathering outside. So Thanksgiving is really going to be telling. And of course, the Hanukkah and Christmas and winter holidays are even going to be more telling. I think what we're also really concerned about is the January return to school for both universities and high school kids. We saw this surge in the fall, and we are doing everything we can to prevent that from happening again. It started with testing. So before universities went on their winter break, a lot of them are virtual right now between Thanksgiving and New Year. Everybody was tested, so they knew their status before going home, and we have robust plans in place to continue university and high school testing come January so that we can keep our schools and universities safe and prevent that spread from the young to the older population.
Thank you very much.
By the way, before we take the last question, I'll just mention too that as I've met with other governors around the country and I've talked with the current administration, what we see in Utah is not unique. If you had graphs of all the 50 states, you'll find the graphs pretty much mirror each other. Maybe a little different timeline here and there, and maybe a little higher spike in some of the states than others. But everybody's facing the same thing. Nobody, as I've said, has found the magic formula to solve the problem. It's a matter of how can we, in fact, get through this challenging time, these troubled waters, with minimal loss of health care and life, and minimal loss of good health, and also a minimal loss of the economy. And so, as I've said from the beginning, I say it again today ad nauseum, it's really trying to find that balance point where we can navigate these troubled waters until we get the vaccine, which will help us. And we're doing that. But again, we cannot overemphasize personal responsibility. It doesn't matter if the government makes you do it or tries to make you do it. It's a matter of us taking on the responsibility ourselves to do it. So that will take the last question.
Yeah, hi, Dr. Dunn. When it comes to the actual new recommendations, the new guidelines from the CDC, could you describe some of the differences between the old guidelines and the new guidelines? Is it just that they don't have to wait 14 days? They now just isolate for 10 days? Is that the only difference, or is there more to it?
Yeah, so when we're comparing kind of before today, our Utah quarantine guidelines to today, the Utah quarantine guidelines, of course, the first main difference is prior we were recommending a 14-day quarantine because that's the incubation period of the virus, meaning that if you make it 14 days without any symptoms or testing positive for COVID, you're really at next to no risk for developing COVID from that exposure. Now we're going to a 10-day, again, just to limit the hardship on individuals. There's still that risk in those 4 extra days of developing COVID. So people who adhere to a 10-day quarantine really need to watch for their symptoms in those 4 extra days and isolate immediately upon having symptoms. The other piece is now we're allowing people to test out of quarantine. So if you have a negative test on day 7 of your quarantine, you can end your quarantine then and there as long as you have no symptoms. Again, the risk isn't zero. You can still develop COVID in the next 7 days. So it's important to continue wearing a mask, practicing physical distancing, and of course, if you become symptomatic, isolate immediately. But we're hoping that this helps people adhere to quarantine a little bit more and decrease spread, but also, of course, allow people to limit the unintended consequences over a long quarantine of 14 days.
Let me just conclude by saying, again, there's a lot of information available if you go to coronavirus.utah.gov. A lot of information, and a lot of questions can be answered. Those who are puzzled about a lot of things, please go to that web page that we've got there and see if you can't find some answers. If you have any questions after that, then give us a call. We'll see if we can answer those questions directly. We're going to continue to ramp up testing. We think that's a part of the solution. With a particular emphasis on our students, particularly in college and high school. Testing is going to help us find those who are asymptomatic and get them isolated so they don't spread. It'll help us slow the spread down, and I think that's going to be a key to us navigating this troubled time, waiting for the vaccine. And the good news is the vaccine is coming. It's not a matter of if, it's maybe a matter of when, but it's just a matter of in the next couple of weeks, and we'll start vaccinating people. And that'll ramp up as we go through the springtime until eventually we're going to have an opportunity to vaccinate anybody who wants to be vaccinated. That means 2021 is going to be a good year. We get into the summer months, we'll be in full-blown recovery, I believe, on the trend that we're in right now. That gives us hope and optimism. We know how long we have to endure this challenge, but the next 60 days are going to be critical. And it boils down to not just hearing ad nauseum wearing of the mask, we know it works. Social distance, we know that's the best thing you can do, stay away from people that are sick. The proper hygiene, isolation somewhat with just members of your own household, that minimizes risk. But taking on that individual responsibility is really an important aspect of what we're doing here and what we should be doing as citizens of this community, this state of Utah, and this country. And we all have a role to play. We all can do our part. We all do a little bit, and a lot can be accomplished. So again, I think we're in a good place. Again, a challenging time over the next 45 to 60 days to help us maintain, and then we'll see, I think, relief happen as we get into the springtime, more outdoors, and the vaccine will become more and more available to all of us to participate in being inoculated. So stay strong, as I say, Utah. Take on the responsibility, do your best, adapt, innovate, and overcome, and we'll do it together. Thank you very much.
All right. Thank you, everyone. Thank you, Governor Herbert and Dr. Dunn. Just one little note on the website. If you go to the homepage of coronavirus.utah.gov and look on Protect Yourself, that is where you can see the latest quarantine and isolation guidelines as they were just updated. So thank you very much to all of our interpreters and for all of our partners in the media.